If you've noticed pain in the center part of your knee after starting a new workout routine or simply from climbing the stairs, you are not alone. Nearly 3 million people report anterior knee pain each year. But here to talk about the causes and some ways to treat it, Dr. Heather Richardville from Stepping Up Physical Therapy. Thanks for
Hi.
joining us.
Yeah, thank you.
So why don't we kind of start with what is anterior knee pain and kind of what causes that?
Sure. So anterior knee pain is kind of like a catch-all term that we use to describe pain that's occurring in the front of the knee joint. So some people call it patellofemoral pain. Basically, it's just pain that's occurring when every time your knee flexes and extends, you kind of have pain there. So running, jumping, stair climbing, things like that will cause pain.
Is that as a result of an injury or, how do you get to the point where you're having that pain?
Sure. So this time of year especially, we tend to see a lot of that. It's February. People have had a month to kind of attack their New Year's resolutions, getting fit, exercise programs. Starting a program too abruptly and not really be conditioned for your sport or your exercise can kind of lead to this pain. So what's happening basically is it's a muscle imbalance in the knee joint that causes this pain. So generally we see tight hamstrings and really weak quadriceps. So that causes what we call a maltracking or improper movement of that kneecap across the joint. So every time that knee flexes and extends, that kneecap has to track over that joint. If the muscles aren't balanced, then that can kind of cause pain and inflammation in that joint.
So how do you treat it?
First, we have to treat the pain and the inflammation. So we kind of do that a lot of different ways. If you come into the clinic, we're going to use soft tissue mobilization or massage, ultrasound, taping, anything we can do to get that pain and inflammation out of there. Because pain over time leads to inflammation, and inflammation over time stops muscles from functioning efficiently or biomechanically for your body. So we need to stop that muscle imbalance from occurring.
And then real quickly here, how can we prevent this so that we don't have to get into the fixing mode?
That's the important question, because if we just stop at the pain and inflammation and send you out the door, we're really doing you a disservice, and we don't do that. We kind of address you globally. What's strong, what's weak, what needs stretched, what needs strengthened, and we look at you as a whole person and say, hey, is that a core issue? Is that a back issue? Is it a thigh issue? What is the issue going on here, and how can we address it so that it doesn't happen again?
Right, because sometimes strengthening something nowhere near where it's hurting is actually causing that pain. So you've kind of got to evaluate
Exactly. It's very rarely ever just a knee issue. It's kind of globally, your body isn't functioning biomechanically the way it should, so we need to address that.
Perfect. Thank you so much for joining us today, Heather. And you can find out more about Stepping Up Physical Therapy by calling the number there on your screen. We'll send it back to you, Pat.